You're welcome. Let's talk about constipation. It's a problem with passing stool. Constipation generally means passing fewer than three stools every week or having a difficult time passing stool. Constipation is fairly common and most of the times, and a lack of dietary fiber, fluids, exercises can cause constipation. But at the same time, other medical conditions or certain medications may be the cause of constipation. And when we're talking about constipation, it's usually treated with changes in diet, exercises, or with non-prescription medicine. And when we're talking about this, constipation may require medicine changes most of the time, or other treatment prescribed by a healthcare professional. And long-term constipation, we also call it chronic constipation. This may, of course, require treating another disease or condition that can cause or worsen constipation. You understand? And some of the symptoms of constipation that include, most of the times, fewer than three stools a week. When you are not pooping like up to 3 times a week. Hard stool, dry stool, lumpy stool, straining when you are forcing it, or pain when you are passing the stool, a feeling that not all stool has passed, a feeling as if your rectum is blocked. Then at times the need to use your finger to pass a stool is constipation. And when we're talking about chronic constipation, is having two or more of these symptoms that we just talked about for 3 months or even longer than that. Then when to see a doctor. You have to make an appointment with your healthcare professional if you have constipation with any of the following symptoms or condition. Number one, symptoms that last longer than 3 weeks may be an indication for something. Symptoms that make it difficult to do everyday activities. Then, of course, bleeding from your rectum, or when you have blood on your tissue paper, or blood in the stool, or black stools, is a sign that there's something wrong. There are other unusual changes in the shape or color of your stool. Or at times you have chronic pain that does not stop, or when you have weight loss that is not, that you are not trying and you're just losing weight, or without trying, or other factors. A number of conditions affect the work of the muscles around the area, the nerves, the hormones involved in passing stool. Then when we're talking about chronic constipation, it may be linked to any number of things, which we'll be talking about shortly. Number one, there's something we call irritable bowel syndrome. Number two, it might be as a result of the diabetes mellitus. It might be as a result of multiple sclerosis. It might be a result of nerve dysfunction or nerve damage. It might be as a result of overactive thyroid, when your thyroid hormone is working, which we call hyperthyroidism. It might be as a result of Parkinson's disease. It might be as a result of pregnancy. So what are the risk factors? Risk factors that may increase your risk of chronic constipation include: 1, be an older adult, being a woman getting little or no physical activities, having a mental health condition such as depression or eating disorder. Those are some of the things that can prevent it. See you in the